there's this new White House report that was obtained by NBC News. It calls the spread of the virus aggressive, unrelenting, and expanding, and says that the current mitigation efforts are, quote, inadequate.
So every day we hear the numbers, and this morning we want to spotlight two communities that are in the thick of the fight. The county of El Paso, Texas, now has more cases than 14 states have in total.
That's remarkable. Meanwhile, the state of Wisconsin, among the worst in the nation right now, the number of cases and deaths exploding there over the past month. This morning, we're joined by two doctors on the front lines in those two aforementioned places. Dr. Jeff Pothof, ER physician and chief quality officer at University Hospital in Madison, Wisconsin. Dr. Emilio Gonzalez-Ayala is a pulmonary and critical care specialist in El Paso, Texas. Gentlemen, good morning to both of you. Dr. Pothof, let me start with you on this breaking news related to the vaccine. Word coming from Pfizer that in the next few days they're going to ask for emergency use authorization. How optimistic should we be, Dr. Pothof, that this is the news that we've all been waiting for?
Yeah, in a time where we don't get very much good news around COVID-19, this news around these two vaccines is just really encouraging. If they are 95% effective, which it looks like they are, and they're safe, which it looks like they are, you know, that puts a light at the end of the tunnel. We've got a way out of this pandemic. And I don't think there's anyone that is hesitant or wants to stay in the current state of affairs a minute longer than we need to.
No, that is for sure. Dr. Gonzalez-Ayala, we should mention that your county alone, El Paso County, has more total cases than 14 states, including South Dakota, Oregon, and Rhode Island. You've been working in El Paso for 24 years, and I know you said you've never seen anything like this.
Never close to this. We've seen every year the influenza season peak in the months of January and February, and not even close. We're seeing numbers go through the roof, and we're at capacity at every facility in El Paso, where hospitals are setting up tents and parking lots to house patients that need that care.
Wow. Gary. Dr. Pothof, your hospital recently converted an ICU meant for neurosurgery into one for COVID patients. But at the rate things are going, is that even enough extra space for you guys?
No, I mean, at this point, we've exceeded the capacity of that neuro ICU that we converted to COVID. We've converted other spaces to COVID. We've started using our children's hospital to take care of adult patients because we don't have room. And we have a hospital across town. We now have to put COVID patients over there. It's really getting out of control.
Dr. Gonzalez-Ayala, I want to come back to you for a moment here. You just said something, and for folks who are watching, El Paso, Texas, do we know why it seems to be so much worse there than it is in just about any other part of this country?
I really don't have a good explanation for that. I think it's a combination of factors, including the holidays that we just went through, including Halloween and Labor Day recently. Also, the return to school recently has made that possible, I think. But I think that relaxing measures, precautions, have led to, obviously, the widespread contagion in the community.
And Dr. Gonzalez-Ayala, as if this year wasn't scary enough, this is the first I'm hearing about this, but you started seeing patients that have both COVID and influenza. My goodness.
Yeah, we're at the beginning of the influenza season. We're already seeing in our ICUs and hospitals cases that have both COVID and influenza. And we're concerned because we are not in the middle of the peak of the season for influenza. So we're concerned about seeing those numbers go even higher. And we're at capacity, as I already mentioned. We're flying patients out directly from the ER to the hospitals in San Antonio and Houston and Dallas to help us deal with this surge.
We've been talking about this a lot on this show, Dr. Pothof, with Thanksgiving just around the corner. A lot of people are still planning to see their families or host even small get-togethers. What would you say to the people, especially in your area this morning?
Yeah, we're really encouraging people to not have those family gatherings. You know, use Zoom, use Facebook. You know, we hear a lot of accolades and kudos thrown towards healthcare workers. If you want to show your support for healthcare workers this year, stay home for Thanksgiving. That's what we need you to do. Wear your mask, stay socially distanced. We can't have Thanksgiving like we did last year.
Fair enough.
And Dr. Gonzalez-Ayala, are you thinking the same thing? Should folks just skip Thanksgiving this year? I mean, is there any reason to have it?
We're pleading with everybody to stay home, to do this remotely, to continue to isolate and avoid gatherings in person, to do it remotely. I have patients calling in for follow-ups in my office via teleconference, and they're asking whether they can go and visit some relative elsewhere. I'm asking them to stay put, to sit out this holiday so they can celebrate the next one next year.
Absolutely.
That's a good spot to leave it. Dr. Gonzalez-Ayala, Dr. Pothof, two doctors really on the front lines of this thing. Thank you so much. Thanks to both of you, and good luck to you as well. And to Dr. Pothof's point, and I hadn't really thought about this until he said it. You know, we talk about our first responders and wanting to honor them. That's the best way, perhaps. That's the best way. Wear a mask and sit out Thanksgiving.
That's a good point.